my side and from our team at the Secretariat of the International Alliance Against Health Risk and Wildlife Trade. Thank you very much for joining us and welcome to today's expert talk on the wildlife health and wildlife trade activities of the World Organization for Animal Health, WOAH, or also formerly known as OIE. WOAH is a highly valued and very active member of the International Alliance, which of course we appreciate very much. Today, Dr. François Diaz from WOAH's Scientific and Technical Department will introduce his organization and WOAH's important work of high relevance to the International Alliance. Dr. Diaz is a renowned wildlife and bee expert with his extensive knowledge in wildlife and biodiversity, bee health, and the international transport of diagnostic specimens. Dr. Diaz brings valuable insights to our community. A French national, he was awarded a Doctor of Pharmacy and also obtained a master's degree in international law and law of international organizations, which I particularly find exciting in the spirit of multidisciplinarity, which is something we're all striving for. So Dr. Diaz will give an introduction to WOAH, and then he will speak about WOAH's wildlife work. Then he will introduce us to the new guidelines for reducing the risk of disease spillover events at markets selling wildlife and along the wildlife supply chain. And he will give us WOAH's perspective on wildlife trade. Afterwards, we will have about 30 minutes for discussion, so feel free to post your questions in the chat already throughout the presentation. We will collect these questions and then discuss them in the discussion. And please mute your microphones in the meantime. And yeah, with no further ado, I will hand over to François. François, the floor is yours.
Thank you, Kim, for the introduction. So good morning, good afternoon, good evening, depending on the place of the world you are. I'm going to present the WOAH activities on the wildlife health and on wildlife trade with more details on the guidelines for reducing the risk of disease spillover events at markets selling wildlife and along the wildlife supply chain. So before presenting these activities, I'm going to present briefly the World Organization for Animal Health. The World Organization for Animal Health, or WOAH, former OIE, is an intergovernmental organization created in 1924, therefore before the United Nations. The headquarters is located in Paris, in France. There are currently 183 member countries. We have 13 regional and sub-regional representation. We work closely with more than 325 reference centers, and we have international collaboration agreements with around 75 partners. The mandate of the organization is to improve animal health, veterinary public health, and animal welfare worldwide. Yes, so the mission mainly, WOAH fulfills its mandate through several missions: transparency of the animal disease situation worldwide, collection, analysis, and dissemination of scientific information, international solidarity, safe international trade of live animals and products of animals through, in particular, the development of standards, food safety, promotion of veterinary services, and animal welfare. You can see on this slide the structure of WOAH. WOAH is composed of the headquarters and of the regional and sub-regional representation. WOAH works for its member countries, and WOAH is supported for this task by experts, elected experts in the Specialist Commission, designated experts in the ad hoc and working groups, and finally the expert from the network of reference center. So each member countries is represented by a delegate. Most of the time, it's the chief veterinary officers of the country. The delegates, since 2009, can be supported by 8 focal points. The focal points are designated for the following topics: communication, animal production, food safety, veterinary products, veterinary laboratories, animal welfare, animal disease notification, aquatic animals, and wildlife. The World Assembly of Delegates is the highest authority of WOAH. It comprises all the national delegates from all the member countries. It meets at least one time per year in May for the general session. It votes the activities done during the past year and also for some future activities. These World Assembly of Delegates adopt in particular all the WOAH standards, and the rule is one member, one vote. So now I'm going to present the WOAH activities on wildlife health. And so the WOAH works on wildlife and biodiversity through different activities, which are summarized on this slide. They are the working group on wildlife, the development of standard, WAIS and WAIS-wide, the network of focal points, the network of experts, the publications, and finally, the wildlife health framework. I'm going for all of them to provide you with more details. And so let's start by the working group on wildlife. The working group on wildlife was created in 1994. Its main objective is to inform and advise WOAH on all wildlife health issues. It currently comprises 7 members who are scientists recognized worldwide for their knowledge in their respective disciplines. The working group meets 2 times per year in person at WOAH headquarters and also several times during the year by teleconference. The working group reports directly to the Director General of WOAH, who forwards the report or relevant parts thereof to the appropriate WOAH specialist commissions. You can see on this slide the 7 current members of the working group on wildlife who are spread across all the world regions. So we have the Dr. William Bikarich from USA, Professor Koshi Murata from Japan, Dr. Marcus Hofmeyer from South Africa, Dr. Rupert Woods from Australia, Dr. Jonathan Sliman from USA, Dr. Marcela Huart from Argentina, and Professor Marie-Pierre Risser de Gurgis from Switzerland. But unfortunately, WOAH, the working group, and I felt a deep sense of loss following the recent passing of Professor Marie-Pierre Risser de Gurgis. She had provided a tremendous service to WOAH, but also to all the wildlife community worldwide. So I would like, by this slide, to honor her memory. So all the information related to this working group on wildlife, including the report of the annual meetings, are available on the WOAH website. And so you have here you have the QR code if you wish to connect. And so now I would like to present also another main mission of WOAH, which is a development and updating of standards on animal health for its members, and some of these standards relate to wildlife. So here I'm not going to go into details and to give the different standards that relate to wildlife, but just to give you what are the publications. All WOAH standards are laid down mainly in 4 publications: the Terrestrial Animal Health Code, the Aquatic Animal Health Code, the Manual of Diagnostic Tests and Vaccine for Terrestrial Animals, and the Manual of Diagnostic Tests for Aquatic Animals. Both codes provide standards to improve animal health and welfare and veterinary public health worldwide, including standards to ensure safe international trade in terrestrial and aquatic animals and their products. Both manuals contain internationally validated diagnostic methods and other biological products, such as reagents. And the terrestrial manual also contains procedure for the production and control of a vaccine. These publications cover cross-cutting topics such as the validation of diagnostic tests, animal disease surveillance, or animal welfare, and set standards for 120 diseases which are listed by WOAH and regularly updated. All these publications are available also online on the WOAH website. But one also important mission of WOAH is the transparency of the animal disease situation worldwide. And to fulfill this mission, currently two important tools. The first one is the World Animal Health Information System, or also called WAIS. And we have also WAIS Wide. They are internet-based computer systems that allows integration of data on animal disease to inform the international community, and all member countries notify WOAH of their animal health situation every 6 months and any exceptional epidemiological event within 24 hours. This obligation applies to a limited number of diseases listed by WOAH, and which is of 120 in 2023, as well as emerging diseases with significant morbidity or mortality rates or zoonotic potential. The two semi-annual reports for a year are combined to form the annual report for the WOAH listed disease. The annual reports are supplemented by member countries once a year by sending information on disease not listed by the WOAH, on the impact of zoonosis on humans, on the animal population, on the staff of veterinary services, on national reference laboratory and diagnostic tests performed, and, where appropriate, on vaccine manufacturers and vaccine production. All this information is accessible by member countries through the WAIS interface and is available to the general public on the WOAH website. So also regarding the WAIS wild interface, it refers to 53 diseases that affect wild animals but are not listed by WOAH. Recently, fact sheets have been developed for some of these diseases with the aim of addressing all of them in the future. These datasheets provide information on the nature of the pathogen, the epidemiology of the disease, and the diagnostic test that can be used. These datasheets are available on the WOAH website, and also this information on animal disease, and in particular in wildlife, is very important for promoting biodiversity and wildlife conservation, but also for raising awareness of emerging threats for a better protection of human health and animal health. So now we are going to see the WOAH national focal points. We saw in a brief during the overview of the World Organization for Animal Health that the focal points are persons appointed at the level of each member country by the delegates for a specific area. Originally, the focal points for animal disease information were the only focal points. However, in 2008, it was asked to the delegates to nominate additional focal points for 5 other areas, and in particular for wildlife. We have now, 8 focal points for 8 topics. And since the creation of these wildlife focal points and their nomination in all WOAH member countries, 5 training seminars have been organized for these focal points, and the 6th one is being organized currently. Each cycle focuses on a major topic related to wildlife disease surveillance and included the organization of a regional seminar in each of the 5 regions defined by WOAH at the global level. You can see on this slide the 5 training manuals that were developed for each of the cycle. They are freely available on the WOAH website, and they are available in English, in French, and in Spanish. And I think now we have also the 6th one, which is available on the WOAH website. So we have seen that WOAH works with experts through the specialist commission, working groups, and other groups. WOAH also works with a network of experts coming from the reference center. And so these networks includes experts from the WOAH reference laboratory and the WOAH collaborating center. For wildlife, we have 4 relevant collaborating centers: the collaborating center on research, diagnosis and surveillance of wildlife pathogens located in the United States of America, the collaborating center on training in health management of the domestic wild animal interface located in South Africa, the collaborating center on bee health in Africa located in Kenya, and the collaborating center on marine mammals health located in Spain and Italy. We also have many reference laboratories for specific diseases that are relevant to wildlife. For example, we have a reference laboratory for rabies, African swine fever, or avian influenza. So in addition to these WOAH international standards that I presented earlier, WOAH also published several different types of documents on various areas related to animal health and in particular wildlife health. You can see on these slides some of them. So among the WOAH publications available online, we have the scientific and technical review. There are 3 issues per year of this publication, 2 thematic issues, and the third one, which is a selection of articles submitted spontaneously by authors from all over the world. And you can see on this slide some issue of the scientific and technical review relevant to wildlife. It's 1 issue on the concept of One Health, 2 issues dedicated to invasive species, and finally 2 issues dedicated to the infectious disease of wildlife. So, of course, you can see that these publications are a little bit old, but so the aim is to have regularly some update, and so it depends on the topic. But after also, we have, as I mentioned, we have the technical disease cards for most of the non-WOAH listed diseases affecting wildlife. And you can also find on the WOAH wildlife portal different guidelines and reports, such as the guidelines for assessing the risk of non-native animals becoming invasive, or a rapid review of evidence and managing the risk of disease emergence in the wildlife trade. Not mentioned in this slide, you can also find since a few months in this wildlife portal a monthly wildlife disease situation report, which is a report of the WOAH listed disease affecting wildlife reported to WOAH on a monthly basis. So on this slide, you can see publications developed in collaboration with international partners. For example, we have the guidelines and the manual on risk analysis of wildlife disease developed in collaboration with the International Union for the Conservation of Nature. We also have the guidelines for the control and prevention of pest deputy ruminant in wildlife population developed in collaboration with FAO. So to conclude this presentation of the general WOAH activities on wildlife health, I would like to mention the wildlife health framework. So the wildlife health framework constitutes, in a way, the WOAH action plan for wildlife and biodiversity for the next 5 years. In summary, this framework has an overall goal, which is to protect the health of wildlife worldwide by embracing the One Health concept. 2 major objectives. Objective 1 is for WOAH members to improve their capacity to manage the risk of pathogen emergence in wildlife at the human-animal ecosystem interface. Objective 2 aims for WOAH members to improve surveillance system, early detection, and reporting of wildlife disease. To achieve these objectives, 6 work streams have been identified: the update and the development of guidelines and standards related to wildlife health, the improvement of reporting and analysis of quality wildlife health data, strengthening the capacity of members in wildlife health management, the development and dissemination of scientific knowledge, the communication and awareness rising on the importance of wildlife health, and finally, the promotion of multi-sectoral coordination and collaboration with stakeholders including WOAH international partners working on wildlife health. So now I'm going to present you in details the guidelines for addressing disease risk in wildlife trade and briefly the future WOAH activities on wildlife trade. So before starting this presentation, I would like to give some background information regarding wildlife and wildlife trade. Wildlife provides essential ecosystem services and are a key component of overall biological diversity. Wildlife is also an important source of protein, income, and livelihoods for many local or rural communities, whilst also important for national and regional economies through tourism and nature-based recreation. Wildlife trade and markets selling wildlife are part of this local, regional, and national system. However, unregulated, unsustainable harvest, use, and trade of wildlife can pose a threat to animal health and welfare, have detrimental impact on species conservation and biodiversity, and can have serious public health implications. In addition, the risk of pathogen spillover and disease emergence is amplified by steady increase in level of interaction between humans, wildlife, and domestic animals. So the development of the guidelines was envisaged following a series of preliminary steps. A statement released by the WOAH Wildlife Working Group on April 2020. The development of the WOAH Wildlife Health Framework at the end of 2020, early in 2021. And finally, with a consultancy on a rapid review of evidence on managing the risk of disease emergence in the wildlife trade, completed in 2021. The guidelines were developed by WOAH ad hoc groups, which is a group of experts that met 7 times through virtual meetings from June 2021 to December 2022. The experts come from different sectors: wildlife crime, wildlife trade, animal welfare, risk assessment, veterinary services, animal health standard, ecology, public health, social and behavior change, and system seeking. So the guidelines provide an approach to facilitate users to identify and select pragmatic, flexible, adaptable, and relevant disease risk reduction and intervention strategies according to identify disease risk, capacity, and needs to ensure feasible, effective, and sustainable implementation on the ground at markets selling wildlife and along wildlife trade supply chains. The primary target audience for these guidelines are veterinary services, wildlife authorities, public health authorities, other competent authorities with a mandate on animal health and welfare, public health, wildlife management and trade, and law enforcement. However, it's expected that these guidelines will prove useful for a wide range of stakeholders involved along the wildlife trade continuum, including both governmental, non-governmental, and community-based individuals and organizations at local, subnational, national, regional, or international levels. And also an important point is that over time, the interim guidelines will require review and revision as new knowledge is generated and shared. So here you can see on this slide a summary of the content of the guidelines that provide a step-by-step approach. When the wildlife trade supply chain or interface has initially been identified, the first step is to identify and engage stakeholders and experts. The next step is to assess the balance among the disease risk, conservation risk, and socio-economic value. A further step is to conduct a risk analysis to identify and prioritize the disease hazards. Then we have a step to develop and to revise management and intervention strategies. Finally, a step to establish metrics for each intervention and to monitor and to assess effectiveness. An important point is that considerations and approaches outlined in each step are interdependent. And therefore, at each stage, opportunities for review and adjustment should be built in accordingly. For example, identification, engagement, and communication with the stakeholders and experts should be considered when undertaking risk assessment, exploring intervention strategies, as well as during the development of a monitoring and evaluation framework. So now I'm going to go step by step, and I'm going to start with the first one. So the first step is to identify a wildlife trade supply chain or interface for which disease risks are to be explored and reduced. And you can see on this slide a generic wildlife supply chain. Wildlife supply chains can be far more complex than this diagram, of course, but however, this diagram is useful to show this complexity and to present critical control points or interfaces where the guidelines can be applied. So here, I'm not going to also to go into details because it could be long. So I'm going to go to the next step. And the next step is to identify and engage stakeholders and experts. This step is important as it will allow to gather all the persons involved or interested in this wildlife supply chain and to consider their view and consideration with diverse and potentially conflicting perspectives and interests, as well as those responsible for the implementation or for the funding of the risk assessment and risk reduction process. So stakeholders in wildlife trade and use include competent national and international authorities and related frontline personnel mandated on animal health and welfare, public health, wildlife management and trade compliance, and law enforcement. The wildlife supply chain itself includes individuals pursuing several different livelihood opportunities, from the rural hunters and harvesters to various levels of buyers involving transaction points via urban vendors, commercial retailers, restaurants, and consumers. The use of wildlife is also part of the livelihoods, culture, and tradition of numerous indigenous people and local communities around the world, and their knowledge and effectiveness in conserving wildlife provide a clear rationale to meaningfully involve them in decision about future use and management. So you can see on this table, so all the potential stakeholders that I mentioned, but of course it can go beyond. It will depend of the situation. The next step is to assess the balance among the disease risk, the conservation risk, and the socio-economic value. Indeed, decisions related to managing disease emergence and pathogen transmission within the wildlife trade sector are complicated by the diversity of this trade and by the potentially competing objectives of sustaining economic development, conserving biodiversity, and protecting public health. As a consequence, consideration of risk relating to disease emergence and pathogen transmission cannot be made in isolation. There is a need also to consider the benefits for local or rural communities and national economies of the wildlife trade, as well as the detrimental impact on species, people, and ecosystem. This complexity creates an array of potentially competing value and needs that should be considered when deciding on disease risk intervention strategies. Defining the decision alternatives, what options are there, and the decision criteria, what is important, are components of the process. Consequently, making decisions in the face of this complexity require adoption of thoughtful decision tools and framework. The decision framework should account for complexity, uncertainty, and consideration of competing interests, and therefore should be informed through an inclusive, equitable, and transparent process involving stakeholders. You can see on this slide a table which provides a possible framework to support informed disease risk reduction decision-making in the face of this complexity. So once the balance has been assessed among the different objectives, it's time to conduct the disease risk as such to identify and prioritize the disease hazards. Risk analysis provide a systematic approach to estimating the risk in order to identify and implement appropriate measures to control the risk and to communicate information about the risk and the control measure applied. It's a process composed of hazard identification, risk assessment, risk management, and risk communication. Selection of appropriate risk reduction strategies will be informed by the risk analysis, and the strategy or strategies selected will need to be balanced across multiple objectives we saw previously. So one, first, the sustaining economic development. Second, the conserving biodiversity, and third, protecting public health. The risk analysis field specific to wildlife markets and the wildlife supply chain is rapidly developing with several recent publications. And you can see on this slide a list of factors to consider when assessing the disease risk associated with the wildlife markets and wildlife supply chains coming from this publication. So the next step is the identification and update of disease risk management solution. And given the variety of species involved in the wildlife trade, as well as the different harvest, transport, marketing, and consumption practices, there is no single correct approach. And decision on disease risk management measures and plans are ideally based on the outcome of a risk assessment process and should aim to be solution-focused while being attentive and adaptable to different socio-ecological, socio-political, and or cultural settings and contexts. So an important point also when considering disease risk management in relation to wildlife species specific information to inform risk management may be limited or biased. Therefore, application of the precautionary principle should be considered. So now, on this slide, you can see what we call the hierarchy of control. So the hierarchy of control is usually applied to a system and details the various control or approaches to minimize exposure to hazards, ranking controls from the most effective level of protection to the least effective level of protection. These guidelines use a modified version of the hierarchy of controls that you can see on this slide to provide a framework to identify potential risk reduction techniques and intervention with the aim to minimize or avoid transmission of potential pathogens from wildlife to other wildlife, domestic animals, and or people at markets and or along the wildlife supply chains. The control methods that you see at the top of this hierarchy of control focus on minimizing or avoiding disease risk when there is a contact between wildlife and humans and their domestic animals. They are considered the most effective, while those at the bottom, like the use of personal protective equipment, are generally the less protective, especially over time. The hierarchy of control can be applied to a specific wildlife supply chain, market, or interface, as for the trade and use of specific species or taxa group, or trade in a specific geographic or social, political, ecological context. An important point is that all intervention across the hierarchy of controls contribute to the total risk reduction. Therefore, you can have a mix of different control methods to reach your risk reduction objective. Each intervention put in place should be monitored and assessed for feasibility and effectiveness, as well as intended or unanticipated consequences, and subsequently adjusted accordingly. So the guidelines provide example of disease risk reduction measure for each of the critical control points, interfaces along the generic wildlife supply chain using the hierarchy of control. You can see on this slide two examples, one for captive wildlife, the other one for harvest, capture, and hunting. There are controls proposed for each step, risk avoidance, substitution, engineering, and administrative. But however, you will notice that there is not PPE and hygiene measures, as we consider that they are standard best practice for reducing pathogen transmission risk, and therefore apply to all wildlife trade scenarios in this table of example. So now the last step of the approach for addressing disease risk in wildlife trade is the monitoring and evaluation. So tackling wildlife trade pathogen transmission risk require context-specific approaches which consider socio-economic, cultural, and other criteria necessary to ensure optimal effectiveness and efficiency. Because these context-specific approaches evolve with time, and it's important to know if the intervention put in place works. Each intervention should be monitored and assessed for feasibility and effectiveness, and subsequently adjusted accordingly. The development of the monitoring and evaluation framework through an inclusive and consultative approach will ensure indicators and benchmarks are pragmatic, realistic, and can be measured. So now regarding these guidelines, the guidelines are already finalized, but they are still in the process of copy editing. They should be ready by the end of June, we hope so. And then the aim is to distribute these guidelines through the WOAH website and the wildlife portal, and also through the network of international partners and the WOAH focal points for wildlife. So now my, so yeah, my last slide. So it's about the activities on wildlife trade, and I would like just to highlight what we currently do, our collaboration with CITES, and we develop a working plan with CITES. This working plan is going to be presented to the Animal Standing Committee, which will be held in Geneva. So it's the CITES Animal Standing Committee, and it will be held in Geneva next week, I think. And this working plan between WOAH and CITES will be presented. And I think it's the main, it's very important to quote these, to refer to this working plan, because it's regarding wildlife trade. I think it's the future activities of WOAH. And I think that's all. So thank you. Thank you for your attention. And I think I am on time.
Fantastic. Perfect timekeeping, François. Thank you very much for this, exciting, basically preview, I guess, sneak preview into the new guidelines and the overview. That's it's fantastic. We have already some questions in the chat, but to everybody else, please feel free to post your question and or raise your hand. If you're in the room, you're very welcome to raise those questions directly. So I'd say we start with Dr. Mosalin, who has asked several questions about training, and there have been some answers or some replies in the chat, but would you just like to come in and ask those questions? here in the room, in the virtual room? If not, I can just read them. And then all the WOAH team present can respond. So the first question was, are there some capacity building programs on WOAH and surveillance planned in the coming month? And then Amelie's already responded, yes, the WOAH team is planning some training sessions in the coming months. Also, there will be the Wildlife Focal Point Seminar in Poland coming up next month. And then Dr. Musalin also asked, have there been some orientation sessions on wildlife framework at country level? Are the country level frameworks also subsequently developed with operational plans? And Keith Hamilton has already responded. Great point, Dr. Musalin. This is one of the next steps to have some pilots at national level. But if you at all would like to, either you, François, or any other WOAH members in the team in this room here want to come in and maybe elaborate a little bit more about upcoming training opportunities. Yes, Dr. Musalan is now raising
Okay. Thank you very much for giving me this opportunity. I think this is a wonderful framework and the wonderful work that is being done. But unfortunately, we have problems in our country in this context, because nowadays we are working on the promotion of One Health in the country, and our specific organization is working very closely with the concerned One Health ministries and departments for the One Health promotion. And wildlife is, I think, is a very critical area to be part of this overall One Health framework. And we have regular meetings on One Health promotion. And I think this framework and this corresponding operational plans would be very critical, because people need to know about all this and they need to get sensitized about its implementation in the country. So I'm more specific to my own country. So we would like to, we will be happy to facilitate an orientation, because we have already an agreements with the government ministries and departments. So we can bring them on board, and probably all this could be discussed, because this is the part we have been talking about, the livestock animals, but not about this all kind of animals, you see. And this is critical, that our decision makers are really oriented, and there are such simultaneous operational plans are developed. And probably we, being the One Health promoters, probably we can play a part over here. Thank you very much.
Excellent. Fantastic. Thank you, Dr. Musalin. François or colleagues, would you like to come in? Keith Hamilton, yes? Please come in.
Only if François doesn't want to speak first. François, do you want to go first and address Dr. Musalin's? I think it's a really excellent point from Dr. Musalin, and be nice to follow up with him. All I wanted to say is, at very high level, is that the guidelines are really just a starting point. We don't want something that just gets put on the shelf. So the next phase is really about working with member countries on implementation and running some pilots, and also tweaking the guidelines over time based on the feedback that we get from some of the pilots. We're aware that they're quite theoretical at the moment, and well done to François for presenting them. It's quite a challenge to present like a, detailed kind of theoretical framework. But really we want to focus on operationalizing this and getting that feedback. And we don't want to be doing that alone either. We realize that WOAH, we have our national focal points for wildlife in countries, and we have our national veterinary services, but we realize that we don't cover the whole area of wildlife health. So we're really going to need to work with other partners in that area. So that's a general fluffy stuff. And François can follow up with some more detailed.
Yeah, so
thank you very much. Yes.
Yeah, it's just to add that yes, we are going to have pilot initiative to implement these guidelines, and the aim will be to do that in collaboration with also partners. So it will not be from our side only, but really with the support also of international partners. and to organize this initiative of pilot training on these guidelines to different countries in the different regions. So from now, we have one initiative that will be held in Thailand, and so this is pretty sure. And after, the aim is to develop initiatives, the same initiative, but in the different countries and different regions.
Fantastic. Thank you so much. There are quite a number of questions, so we're just going to move right along. And there was a question by Iris Ho, will the PowerPoint presentation be shared afterwards? It contains a lot of valuable information. Absolutely agreed. And Isabel, do you want to come in on this one?
Yeah, sure. So yeah, we're planning to move more and more content to the website, and there's a whole members area being built for Alliance members. So you will find all the information like the PowerPoint slides and also the recording via the website.
Thank you, Isa. So next question is by Kevin Smith from IUCN. Kevin, would you like to come in?
Hi, yes, thank you very much, Kim. Francois, thank you very much for that presentation. It was fantastic to see it. I'm really looking forward to seeing the final document when it's finally published. So thanks for that. Yeah, it was just a quick question in relation. So I saw in the risk, I think it was the risk analysis or risk assessment aspect. It was obviously great to see that the risks associated to wildlife is part of that. And then you mentioned as part of that this decision, I think it was like a matrix decision framework, where you made the distinction between the threat being a low threat or a high threat to wildlife. So I was just wondering, is the guidance in the document on how to assess that risk, or is it up to the the national authorities applying this framework?
No, it's a very good question. So the guidelines provide the framework, but after they mention also what you have to take into consideration when you make your risk analysis and the different parameters, the different things that are important. So the public health, but also the wildlife conservation aspect, the economic aspect, but after they don't go into much details, because it's really the decision of each member, that country or people that are going to make this risk analysis, is to see what are the important points for them.
Perfect. Thank you, Francois. That's great. And obviously, just I'm sure I couldn't end this conversation without mentioning, obviously, the IUCN Red List either applied at a national level or a global assessments can obviously support that process. So if you do go down the route of piloting this process, please do get in touch with IUCN. And I see John Paul is also on the call too. So we would love to support that environmental kind of health aspect along the line. So thank you very much.
Thank you.
Fantastic. Thanks a lot, Kevin and John Paul. Ricardo, I've seen that you've raised your hand, but we had already some questions lined up in the chat. Would you mind also putting your question in the chat, and then we can call you up? Yeah, is that okay? Sorry about that, but there's quite a high demand right now to get responses from François. So, Elizabeth, would you like to come in with your question?
Yes, thank you very much. And hello, Francois. Thank you. This was a great overview. I actually just added another question, but the first one is related to the indicators that you mentioned. And I'm assuming that those, you have kind of standard indicators that are included in the guidelines. And I was wondering within those indicators, if there is a kind of collaboration type of indicator. This is something that we're debating or trying to figure out at USAID to monitor One Health activities. And it's understandable to have the technical sectoral indicators for the various sectors, but you also need to capture that collaborative component. And certainly, with risk assessments of, along the entire wildlife trade chain, there are, as you went through, tons of stakeholders and collaborators. So you need to kind of see how well that component is working. Have you had any thought on that?
Yeah, it's a good question. But so you refer to the parameters. So it was I think in the risk analysis, no? It's the list of factors to consider, no?
Well, right, for monitoring the parameters or indicators, what recommendations do you have you included specific examples of those parameters to measure or evaluate?
Yeah, but it's an example, and of course it's not limited. So here the aim was to provide some example, but after it's always up to the situation of the country, of the person that do these risk analysis. It's to see what is the situation and to include the parameters or factors that are relevant for this situation. So I don't know if I reply to your question, but.
I mean, I guess that's okay. I do think there is value in having standard recommendations for indicators or parameters to monitor. Certainly everything is context dependent, but for kind of a global scale data analysis, it's always easier when there are some standardized indicators, to be able to compare across regions or etc.
Yeah.
So just a thought. Thank you.
Yes, but it's a good point. After, maybe I need to come back to the guidelines to be sure, because I think they provide a framework and they provide some that can be used by all, but always you will have some difference between the countries. So after, if you want to make a comparison, yes, it's true that it can be a little bit different depending of the country and also of the part of the sector which is targeted. Because wildlife trade it's big, so you have a different and we saw that in the one of the first slide. The wildlife supply chain is very complex, and so depending on where you target your approach, it can be also different parameters, different factors.
Thank you, François, and thank you, Elizabeth, for that question. I think that's really a very interesting question and thought. Let's continue and move on with Sasha. Would you like to ask your question?
Yeah, thanks, Kim, and thanks, François, for the nice overview. I think my first question is already answered, but the second question is, if you come up with those guidelines and standards, of course, you need to have a good buy-in from the global south as well. So have these guidelines been developed together with those countries, and is that something where you are anticipating to have this done in the future when you set up the workshops and etc.?
Yeah, I think we try, of course, to take into consideration the different situation worldwide, and we had experts coming from the different region of the world with and different background. And but after, of course, it will be during the pilot initiative, and what I mentioned at the beginning of my presentation on these guidelines is that of course it's something which is not fixed. I mean, it will evolve in the future. It will evolve when we have more information, when we start to implement them. We will have also the feedback from the country and from different situations. So it's something living, and that will evolve in the future, of course.
Okay, thank you. Thank you, François and Sasha. Roland, would you like to come in?
Thanks a lot. Can you hear me?
Yes.
Yes.
François, thanks a lot for this brilliant overview. I have a question on the governance of the documents and the standards that you have that you have presented on. Are these standards and codes, will they become mandatory for the member states of WOAH? And if so, are there any mechanisms of sanctions in WOAH? Just out of interest.
Yeah. So there is the standard developed by WOAH, so in the codes and in the manuals, are linked to the World Trade Organization, and so we don't have a body to sanction or to make so that they apply the WOAH standards. It's more through the WTO, because the WTO recognizes the World Organization for Animal Health as the international organization of reference for animal health. So all the standards, but also guidelines developed by WOAH can be used in the framework of the WTO, of the World Trade Organization.
That's really interesting. Thank you.
Welcome.
Thank you. Let's move on. Frank, would you like to come in with your question? I might have butchered her name. Lynn? Okay, so then I will just read it. How would you present these frameworks to government stakeholders in a developing country where there's a lack of resources in managing wildlife farms, and somehow encourage wildlife farming for economic purposes? These frameworks are wonderful in theory, but the question is how to get the government to create attention to the government.
So yeah, it's a good question, but so it's why also in the implementation of the control measures, I mentioned there is the capacity of the countries to develop some measures and to be sure that the measures can be implemented and are efficient. And there is also so it's an approach where you have to see what is possible to do with your needs, but also with your capacity. I mean, at the country level, you have to make a balance between what you want, but also what are your possibility. And so this it's a good point, but it's also a little bit, if I can make the link, it's a little bit like the laboratories, where you need sometimes a very high level of protection and of biosecurity and biocontainment, and you have to adapt, because sometimes it's not sustainable to have a very high measure if you can not maintain them on the time. So you need to choose the measures that you are able to implement and that are efficient on the time. But I know that it's not easy, huh? But it's the aim also is maybe in the future to provide more information for these for the countries that don't have the enough capacity to do a big implementation of measures. But so it could be maybe useful also to think about this in the future.
Excellent. Thank you. Just going to read a word of caution from Keith Hamilton. So word of caution with the PowerPoint is that some of the structure infographics may change in the final version. So although these concepts will remain the same, the presentation may be slightly different. Just pointing that out for those who have not been following the chat. And yes, so Elizabeth, would you like to come in with your other thought, comment?
Sure. Thank you again, and apologies for asking another question that may not be really answerable, but just thinking along the wildlife trade chain, if we start way on the far left end, you know, there is that very important link between wildlife health and ecosystem health. And it may be just, you know, worthwhile highlighting that importance and encouraging collaboration, you know, across, you know, natural resource managers and, you know, wildlife health experts to really evaluate also the health of the ecosystem, to find out, you know, does degrading ecosystem health contribute to spillover risk or increased risk of, you know, wildlife health issues. So, you know, we have a lot of anecdotal and some evidence, but we need to get a much stronger understanding of that. So just planting that seed, I guess. Thank you.
Thanks, Elizabeth. François, would you like to react to that? You're muted right now.
No, I think yes, it's a good point, and yes. So
Okay.
thank you. Thank you.
Okay. And then Keith Hamilton is also mentioning, or just giving a chapeau to Tiggy Grillo from Wildlife Health Australia, seconded to WOAH for 1 year, who has done an enormous amount of work driving the collaborative process forward. So just to recognize her contribution at this point. And then Ricardo, you did raise your hand earlier, but I don't really see a question from you in the chat. Would you like to come in and use this opportunity to ask a question, if it was a question, indeed? Okay.
Sorry, it's not question.
Yeah.
Sorry, it's not question, but only process of working on. Only that. Thank you.
Okay, no problem. Okay, then so Sophie is commenting the pilot initiative will also be used to collect direct feedback from countries to improve the guidelines accordingly. And then we have a question from Lucy. Lucy, would you like to come in?
Yes, sorry, I have to jump off in a second, but just quickly, thanks so much. It's a huge amount of work that's gone into it. So good job to the WOAH team, Tiggy and all. And thanks, Francois. Teams was blocking some of the bottom of the slide, so I apologize if I couldn't read below that. But I just, one thing that just stuck out a little in the decision-making matrix tables, one of under the socio-cultural term was also the term high economic value, which just concerned me, and maybe it's totally unnecessary, and maybe it's a lot more nuanced than that simple table would show. But obviously some of the highest economic value trade might also be considered highest risk. So I would hope that it's not purely of economic value, and then it would be automatically considered okay, especially that some of that high level urban trade that's driven by luxury consumption. So just noting that I would say versus the overall economic value, whether there are economic alternatives and whether that trade is driven by need versus just the economic value would be important to include and consider in those socio-economic cultural components. And then just a comment that others have already noted that, you know, there's already an awareness of disease risk and health risk in many of these countries, but the current resources to address them in any way are severely constrained in many of these countries, particularly in the global south. So certainly to follow these guidelines, to effectively assess and regulate the trade chains and really reduce risk is going to require significant external economic and capacity support. So kind of thinking about already ways that we can help move that forward and ensure that that happens, such as inclusion within international regulations. François already mentioned that can be incorporated in WTO, but thinking about the IHR and some of the human health regulations as well. So just some ponderings there. But thanks so much, François, and for this webinar today.
Thanks, Lucy. François, would you like to react to that?
Yeah, so thank you. So it's true that you have a different part to take into consideration. I mean, you have, of course, you have first the public health, you have the wildlife conservation, and so the wildlife as such that you have to take into consideration, but there is also an economic part. But after, it's in the guidelines, we let's say that we are neutral. We suggest that you have these to take into consideration, but we don't say that the economic is more, for example, is bigger than the wildlife, or the wildlife is or whatever. We say only that you need to take the three into consideration, and depending of the country, depending of the people, maybe you will have a wildlife first, and the most important, it's what we hope, I think, all. And after you have also, of course, the public health, and the economy should be the minor things, but it's you have to take it into consideration. So thank you.
Thank you. So we have only 5 minutes left. Are there any more pressing questions from the audience? Otherwise, I will have one. Okay, doesn't look like it right now. So, François, I'm wondering, you know, like from a perspective of the International Alliance, how could the International Alliance, as an alliance, but also its individual members, support you in this process?
But it's a very, very, very good also point. So the aim is for us is to start to implement them at the worldwide level, and so it's how we work with our international partners is to do that. So the aim will be to if possible to start to implement them and to have some feedback to so that we can also improve them. I think it will be the main point.
Okay, excellent. Do you foresee any process with which the alliance or its members can help you improve, assess, implement, and assess and improve the guidelines? And you don't have to answer this now.
No, but
you can
it's true. If we organize some training on these guidelines to see how they can be implemented, and so in this case we will have some feedback that will be useful to see first if they are useful, if they work well in the different countries and for the different situation, and what we need to improve. So it's more on the implementation of these guidelines through pilot project, pilot initiative. It's, I think, the main part, yes.
Okay, excellent. Thank you. Well, also, I mean, if you know where to find us, if in case you have any more thoughts or can think of any particular ways in which the International Alliance can support you. And also to the audience, if you have any more questions that came up after the talk, I don't know, François, may we pose any questions to you afterwards if anybody has a burning question, so that, yeah, that's great if we can reach out with more questions. So I think overall this has been a really great session, very interesting, and also just by the responses and all the questions being asked, I think this is not only a topic but also a process and a tool that you've presented to us today that is of high relevance to many people in the room and beyond, definitely in our membership, but also of course way beyond that. So thank you for your important work, but also for taking the time today to present it to us and to answer all these questions. It is indeed extremely complex. That's why we're all here. If it were easy, we probably wouldn't need to get together so frequently trying to tackle these wicked problems together. So yes, thanks a lot, François. Again, thanks everybody for joining us today, for taking the time. And yeah, please keep joining us. Please keep asking questions, discussing with us. Also uncomfortable questions, very welcome. We're happy to learn together and to develop and to find answers jointly. So
yeah,
thanks a lot.
Thank you for the invitation.
It was a pleasure to have you.
Yeah,
Thanks, everyone. Sorry.
Actually,
yeah,
Kim,
Isa?
I think if some of the people would like to stay maybe 2 minutes to have a look at 2 questions that we would have for the audience, it would also be amazing.
Thank you very much. Sorry, Isa,
just
I totally
as an
forgot.
offer. Don't worry.
Yes. So as we're evaluating our events, we have prepared 2 short little questions. It would be great to have your reaction. It's just a thumbs up if you feel like it, or a number, I think, right? Isa, if you or Annie, if you could. Yeah. So now these questions have been posted in the chat. So the question is if you have gained any insights from the event, and then also that whether or not the input was relevant to your work. So we will develop this little feedback mechanism a little bit further. This is just a little pilot, but in the future, we would really appreciate if you could give us feedback on our formats. Yes, so thank you.
We see some thumbs going up already.
Yes,
so I think that's a very good sign.
That's great. I definitely have gained insights today, and this for sure is very relevant to my work. So I can only give 2 thumbs up here. Thanks, Alex. Wonderful.
Great.
So thanks all. Hope to see you again soon.
Thank
Keep in
you.
touch.
Thanks, François. Thank you, everyone.
Thank you. Thank
Bye.
you.
Thank you.
Thank you, everyone. Thank you.
Bye.
Bye, everyone.
Bye-bye.
Thank
Good
you.
to see you all.
Thank you. Bye.
Bye. Thank you.
Thanks a lot, François.
Bye. Thanks.
Bye.